Welcome to our video on viral exanthems. Let's get started. Here is our overview slide. We'll be discussing Erythema Infectiosum, measles, rubella, roseola, and varicella. So let's start with Erythema Infectiosum. This exanthem is due to parvovirus B19 and may also be referred to as fifth disease. This viral illness initially presents as a mild febrile illness with flu-like symptoms. After 2 to 5 days of these symptoms, the patient will develop the initial redness of the face and cheeks with perioral sparing. This is the classic slapped cheek rash of parvovirus B19. After appearing on the face, the rash will typically spread to the extremities and trunk and develop a confluent maculopapular appearance. Here's an image of a child with parvovirus B19 infection. Notice the erythematous patches on the child's cheeks. Again, this is the classic slapped cheek rash of parvovirus. In this child, the rash has already spread to other parts of their body and has a confluent maculopapular rash. You can see some of the areas where the macules are joining together with other macules, which is the definition of confluent. There are several complications associated with parvovirus B19. Patients may experience arthralgias, especially if they experience this virus as an adult. In children with hemolytic anemias such as sickle cell disease and thalassemias, a parvovirus B19 infection can lead to aplastic anemia due to infection of the stem cells. Finally, if a pregnant mother is exposed to parvovirus B19 and becomes infected, the fetus can develop hydrops fetalis. This occurs when parvovirus leads to severe anemia in utero, which can then cause congenital heart failure. This leads to the accumulation of fluid in the soft tissues of the abdomen of the fetus, which can be visualized on ultrasound. In severe cases, hydrops fetalis can be fatal. Okay, now let's move on to discuss measles. Measles may also be referred to as rubeola. It has a characteristic catarrhal stage prior to the onset of the rash. The features of this phase are often referred to as the 4 C's of measles. They are cough, coryza, conjunctivitis, and Koplik spots. While the last one starts with a K, it still has the hard C sound. Therefore, this is referred to as the 4 C's of measles. Coryza is an inflammation of the lining of the nose, leading to rhinorrhea and conjunctivitis. Koplik spots are pathognomonic for measles. They're often described as small blue or white spots that are found on the buccal mucosa. Here's an image of Koplik spots, which are, again, characteristic of measles. And as we can see in this image, they're classically found on the buccal mucosa. While they're often described as white or blue spots, they can also appear as erythematous spots, as is the case in this patient. 1 to 2 days after the appearance of features of the catarrhal phase, such as Koplik spots, the xanthem will appear. The rash of measles is an erythematous maculopapular rash that is partially confluent. It begins on the head and then spreads down from the head to the rest of the body. This pattern of starting on the head and spreading down can also be described as a cephalocaudal pattern. In the exanthem stage, patients may also experience generalized lymphadenopathy. Here's an image of a child with the measles exanthem. This erythematous confluent maculopapular rash starts on the head, as it has in this child, and then as the disease progresses, the exanthem would be expected to spread in a cephalocaudal pattern down to the rest of the body. Like most viruses, measles typically only require symptomatic treatment. However, in patients with severe disease, vitamin A supplementation can be used as treatment. One major complication of measles infection is subacute sclerosing panencephalitis. This is a lethal demyelinating condition that leads to inflammation of the brain and occurs secondary to a measles infection. However, it will not present until years after the initial infection with the virus. Finally, it's important to realize that measles is easily prevented with the MMR vaccine, which also includes protection against mumps and rubella. Okay, now let's move on to rubella. Infections with rubella, also known as German measles, often begins with flu-like symptoms and post-auricular lymphadenopathy. It's particularly important to remember the location of lymphadenopathy in rubella because it can help you distinguish between other pediatric exanthems with similar rashes. After the flu-like symptoms and lymphadenopathy, patients will develop a fine, non-confluent maculopapular rash. This rash also starts on the head behind the ears and progresses in a cephalocaudal pattern. As it spreads, the exanthem will spare the palms and soles. Here's an image of a patient with a rubella exanthem. This exanthem appears very similar to the rash of measles and is erythematous and maculopapular in nature. It also spreads in a cephalocaudal pattern, and it will be very difficult to distinguish between measles and rubella just based on the rash. So it's important to pay attention to the prodromal symptoms of the illness to diagnose the virus. Infection with rubella may lead to polyarthritis, especially in adults. And like the measles, rubella is also a preventable disease with the MMR vaccine, which again includes the measles, mumps, and rubella. All right, let's try a question. A recently immigrated mother brings in her 4-year-old daughter due to symptoms of coughing, rhinorrhea, and conjunctivitis. Upon physical examination, white spots are noted on the buccal mucosa. What is the most likely diagnosis? Alright, since this patient and her mother recently immigrated to the US, we have to consider that this patient may not have received all of her immunizations. The patient has symptoms of cough, coryza, which leads to rhinorrhea, conjunctivitis, as well as Koplik spots. As you remember, these symptoms are known as the 4 C's of the catarrhal stage of measles. Therefore, this patient most likely has measles, also known as rubeola. Okay, now let's move on to discuss roseola. This is a pediatric exanthem that occurs due to human herpes virus 6. It may also be referred to as exanthem sebitum, 6th disease, or 3-day fever. Roseola begins with the febrile phase, characterized by an abrupt onset of high fever that can be as high as 104 degrees Fahrenheit. These high fevers can result in febrile seizures. If a child experiences febrile seizures secondary to roseola, acetaminophen can be used to reduce their fever. This fever typically lasts around 3 days before the onset of rash. The exanthem phase of roseola is usually associated with a sudden resolution of temperature. Then the patchy maculopapular rash of roseola appears. The rash is sometimes described as rose-colored or lacy in appearance. In contrast to other exanthems we've discussed so far, this rash begins on the trunk and then spreads to the extremities. This image shows a child with the roseola exanthem. The rash of roseola is often described as patchy and maculopapular in appearance. Other words used to describe it include rose-colored or lacy, which both can be seen here on this child. Okay, now let's move on to the final virus of this lecture, varicella. Varicella is commonly known as chickenpox and is a highly contagious virus. It typically presents with a prodromal phase 1 to 2 days before the exanthem, which consists of fever and malaise. However, some children may not have this prodromal phase, and the first signs of infection can be the exanthem itself. The rash of varicella typically begins on the trunk and then spreads to the face and extremities. It's an extremely pruritic rash and can cause a lot of discomfort for children. It appears as erythematous macules that then progress to vesicles filled with clear fluid. These vesicles then rupture and crust over. The hallmark of the exanthem of varicella is that you'll see all of the different stages of the rash present at once. Here is an image of an infant with the varicella virus. The most important thing to notice about this rash is that the lesions are in different stages of healing. Here, there is an erythematous macule. Here are vesicular lesions, and here is a vesicular lesion that has ruptured and is now crusted over. As we can see, the rash is in different stages of healing, and this is very characteristic of varicella. Patients with varicella usually only require supportive care with calamine lotion or oral antihistamines to decrease the itching. However, in immunocompromised patients that experience more severe disease, acyclovir therapy may be required. Like measles and rubella, varicella is a pediatric exanthem that can be prevented with vaccination. Here is a summary slide of the information we've covered in this lecture. Feel free to pause the video and take a few minutes to solidify the information. All right, let's wrap up with a final question. An 18-month-old Mexican immigrant boy presents to the clinic with his mother due to generalized body aches, chills, and flu-like symptoms that began several days ago. Physical examination reveals a fever of 38.9 degrees Celsius and a maculopapular rash. His mother states that the rash began on the head and spread downward, sparing the palms and soles. Additionally, lymphadenopathy is present behind the child's ears bilaterally. What is the most likely diagnosis? A. Rubeola, B. varicella, C. roseola, or D. rubella. All right, this is an 18-month-old male who has recently immigrated from Mexico, so we should consider the possibility that he may not have received all of his immunizations. The main complaints are flu-like symptoms, which include fever, body aches, and chills. The patient also has a maculopapular rash, which started on his head and then spread downward, sparing the palms and soles. And he also has post-auricular lymphadenopathy. Hopefully this presentation makes you highly suspicious for rubella, also called the German measles. So the correct answer is choice D, rubella. Answer choice A is incorrect because rubeola, which is also known as the measles, presents with a similar rash, but shows the 4 C's of cough, coryza, conjunctivitis, and Koplik spots, which this patient does not have. Rubeola also does not present with post-auricular lymphadenopathy. Answer choice B is incorrect because varicella, which is also known as the chickenpox, presents with a rash that starts on the trunk and spreads outward. Varicella also shows a rash in mixed stages of macules, then vesicles, which then rupture and crust over. Answer choice C is incorrect because roseola typically presents as an abrupt high fever which lasts about 3 days and then resolves as a rose-colored or lacy rash appears. The rash of roseola begins on the trunk and spreads to the extremities, unlike the rash in this patient. So again, the correct answer is choice D, rubella. And that concludes this lecture.